Instant access to patient data in an age of dynamic clinical trials isn't just a nice to have, it's a necessity. ACM Global Laboratories is committed to providing exceptional customer service and quick visibility to trial data through our interactive client portal. The new portal and its dashboard, which functions on most major web browsers, highlights 30 days of individualized patient reports and easily grants the ability to order more study kits, build ad hoc reports, track approvals, fulfillments, and cancellations. So let's take a deeper look into the portal, beginning with its customizable dashboard homepage. So you'll notice on the dashboard homepage, you'll have 4 different sections. You'll have your recent patient reports, generalized reports, your report files, and kit ordering. Also to note on the homepage dashboard, there is a link to our training documents, as well as a link to give customer feedback. And at the top right-hand corner, there's also a spot to contact our study support team. Within the recent patient reports data, you'll see that anything that is linked in blue is a clickable link, as well as the PDF icon next to it will bring up a PDF report of that order. So if we click on the first one, it's going to bring up the patient report with the demographics and results below. You'll also have a link to that PDF report, and it's going to open up in a separate tab in your window. And this is the true patient report that has been sent out to the investigator site. Again, anything that's blue is a link that's clickable. If we click on View Cumulative Report, it will bring up the report cumulatively for this subject, all of the visits that we have seen. We go back home to the dashboard. We'll continue to go through the other sections. The other item to note is your entries, how many recent patient reports that are viewable. You can change that from 5, 10, 25, all the way up to 500 to be able to view a bigger section of those recent 30 days past reports. The next section is our general reports that are already been set up within the portal itself for your use. Your abnormal summary report is going to bring up any values of results that lie outside the normal reference ranges. Our enrollment detail report is going to be a report of every subject as well as the date of every visit that we've received thus far for the study. Enrollment summary report is just going to be a condensed summary of that detail report, only showing the numerical numbers of how many subjects have been seen at a certain investigator site. Our investigator summary report is going to show all of the action items and data inconsistencies that we sent out to sites. Open and closed will show, as well as that closed out information. Our missing visits report will show if a visit's been missed in a series for a subject. So if you had a visit 1, 2, 3, and 4, and the subject has missed visit 3 between visit 2 and 4, that will show up on this report, as well as our pending samples report. The web portal only shows final samples, final results. So the pending samples report show you any results that are still pending. And our trend analysis report, you can trend out results through the life of the study on certain analytes. You also have a function called My Report Files, and you can create your own ad hoc report, and those reports will show up here on this tile. And in a moment, we'll go through how to create an ad hoc report. But the next tile is our kit ordering section. So you can toggle between the orders that have been requested, approved, fulfilled, and or canceled, or you can click on kits and the same information, requested, approved. Approved status means that the order has been approved in our system, and there are 9 kits for this to be created. Fulfilled are all of the kits that have been fulfilled and sent out to sites. And then canceled are any orders that have been canceled. Again, anything blue is a linkable button. So this View More will take you over to the Kit Ordering tab. And before we jump into the Report tab, I just want to show one other item up in the upper right-hand corner. Underneath your username, you will have your user protocol. And there are certain settings that you can look at underneath your username. You can update and change your password, look at your login attempts, as well as update any settings. Within my settings updates, you will be able to toggle in between the protocols that you see on your dashboard and or completely log out. We also have another nice feature on the home dashboard, and that's the little magnifying glass. You click that, you will get a drop down for a rapid search function where you can search in between your different protocols that you have access to by selecting either the session number, collected date, collected time, by investigator name, visit name, subject ID, any different searchable information within the portal. If you select requisition number, you'll be able to place that number in and hit the search button. So that is more of a rapid search to look further past the last 30 days within the portal itself. And that again is underneath the magnifying glass. Now we'll jump over into the report tab. When you first click on the report tab, you'll have all of those generalized reports that are also on the dashboard homepage. Again, you can link them through here. You'll also have your report templates and then your My Report files. To build an ad hoc report, you're going to go into Report Templates, and any ad hoc reports that you've already built out will be below Report Templates. You have different actions you can do within those reports that you've already created. You can run them, you can edit them, you can copy, share, and or delete. And I will pop up the share option as that is something very nice to have within our portal. Any ad hoc report that you've created within the system, you can email off to any other user within the system. So your ACM project management team will be able to develop a report for you and email it to you using this share option, and then it would show up in your report templates to utilize. We're going to go through and create a new report template. Step through that process. You're going to pull up the protocol. You're going to select your unit, conventional or SI. You have the option of your date ranges, whether it be last week, last month, all the way up to the life of the study or any custom range. You will give it a report name, and you will hit the next button. You can either hit the next button or go up into the tabs up top between the fields. At this point, all of the available fields that you have are on the left-hand side, and each one you're just going to drag and drop over to the right. And if you've gotten the selected fields over onto the right-hand side and you want them in a different order to show the Excel spreadsheet, you can just move them around. Once you're happy with that, you're going to either, again, hit next or come up to the tab, sort field. And this is where you can do them A to Z, Z to A, however you would like them sorted. You can also remove them from the sorting field by just swiping them back over to the left. You're going to, again, either hit the next button or the filters, and you can bring in any filter. It would be equals to, greater than or less than, contains, starts with, or ends with. And that will help you filter out the report even further from your information. Again, swipe it back over to the left if you do not want any selected filters. And then you're going to hit the Create Report. So that report has now been saved successfully and will show at the top of your saved report. And at this point, you can, again, either run, edit that report, copy, share with a fellow portal user, and or delete that. When you run a report, it's going to come up and ask you a few different questions. If you still want to run it for that certain protocol, whether you want to change your units and or change your date range, you can just hit submit. And then you will see down here in the right-hand corner, it's telling you your report is being generated and you will receive an email notification. While that is running, you can also go over to My Report Files, and you can check the status of that report that's being run. Currently, the status is saying it has been succeeded. The information is there. Underneath the Actions tab, you can either download it or delete it. If you want to download it, it's going to ask you if you want to. I'm going to say yes, and it's going to open up in an Excel spreadsheet. Once you have that Excel spreadsheet open, you can continue to filter and as needed. You will notice that all of the reports you build in the report template feature is going to show up under your report templates, under the report templates tab. They will continue to be there until you decide to delete them. Another great feature of our web portal is the Kit tab. Under the Order Summary tab, when you click on the Kit tab, is going to be all of the orders for the protocol. They will show whether they've been fulfilled, canceled, or approved, as well as if an order has been fulfilled, you will see the tracking number. Also listed is the kit quantities, how many were fulfilled within this order, the order date and the order time, along with the site information. You can also further search within the order status by requested, approved, fulfilled, and or canceled within the search field, as well as change the start date and end date and hit search again, and it will only bring up the requested kits and or approved, fulfilled, or canceled, however you filter on that. Also within the kit ordering tab is our order form. When you click on the Order Form tab, all of the demographic information for the site will pre-populate. To note that all sites would only have access to their own site, as well as CRO and sponsors would have access to all sites. So if you're a CRO or sponsor, you can order kits for all of your sites. You would just navigate down to the site you are requesting. Again, it pre-populates with the investigator name, the clinic, as well as phone number. You can also change the date of when you need to receive the kits. ACM's policy is 5 to 7 business days from kit order. So this does pre-populate 7 business days out. If you need to have the kits ASAP, you would toggle onto the yes, but understand that there are asterisks next to that ASAP. And if we do get an ASAP order, we will contact the sponsor for approval for that shipping. To add the quantity of the number of kits, you will just go in and free type how many you request. Also, any additional supplies. There's also a free text portion under order notes that you can leave ACM comments on that order if need be. Once you're happy with the supplies and information you need to add within the reorder form, you're going to come down and hit the submit button, and it's going to ask you to re-authenticate your user ID and password. And once you place in your password and hit submit, it will come up and thank you for your order. You'll receive an email within the next 24 hours confirming your order, as well as the order will show up on the order summary page. You can either go back to the order summary page or you can place another order if need be. And within the 24-hour time period, you will see it come up underneath your summary on the order summary page. Another bit of information that you can access under My Settings is to be able to remove the ability to opt in and opt out of email, as that order summary information did say that you would receive an email into your email inbox. If you'd rather not see those types of emails, you can toggle from on and or off underneath your settings. I'm just going to return over to the home dashboard, as I do want to show that when you navigate into certain reports, it does leave you a breadcrumb so you can get back to your original report. And we will do that through the enrollment detail report. I'm just going to run the enrollment detail report. All of our reports will start at the first sample received in date and will end on the last sample received date. So we started receiving samples in May of 2019, and the last one that we received was in October of 2020. Again, any item that is blue is a clickable link, and you'll see our breadcrumb has already started here. We're currently on one patient report, and if you see here, it will take you back to the enrollment detail report. But even if we do get farther down into this more cumulative report, it's still going to link you back to your original enrollment detail report, so you can go back through and look at any other subject you need to. So all of the reports through the portal will have that nice breadcrumb feature that will bring you back to the original report you had started with. The client portal allows for increased study efficiency and added transparency, in addition to serving as a tool for enhanced communication and collaboration across the study spectrum. When you partner with ACM, you're not only partnering with an organization that understands the importance of these elements, you're partnering with a group of dedicated professionals who are committed to seeing each study through with the care and intention they deserve.